So as I said, karyotype or karyogram in detecting non-disjunction. As I said, also karyogram and karyotype is really not that big difference in at this level. Okay, a lot of times biology textbook have different names for the same kind of thing, but karyotype and karyogram essentially is this: you take a picture of someone's chromosome. So typically, you collect a cell sample. You stain, you add dye and stain the DNA in the chromosomes. After that, you take a picture and then you cut them out and then you match all the homologous chromosomes together. In fact, a very common activity that was done, even up to now, it has always been like, oh, the teacher will give you a picture of someone's chromosomes, not nicely lined up like this, but like all jumbled up. And then the activity is asking you, match all the homologous chromosomes together based on length and band pattern. The difficulty of that activity, and one thing I personally hate about that activity, is a picture. And if the angle is wrong or the quality of anything is bad, you can't tell. Like, I always get students asking me, it's like, sir, is this chromosome 2 or chromosome 4? I was like, your guess is as good as mine with this printout. So that is the reason why when we did the experiment, we remember the activity of the make a face activity. I asked you guys to cut out the chromosomes, and in this case, like the very similar, it's really much what we did. Like, you get the 2 gametes package, you mix them up together, and then you try to sort them out, line up all the chromosomes 1, 2, 3, 6, 10, and 19, and sex chromosomes. That activity that you have done was really a hands-on version of making and doing a karyotype or karyogram. Okay, so in some ways, the reason why today you have not learned what karyotype or karyogram is because I haven't really called it by that name, but you have actually done it in that activity. Okay. Now, one nice thing about karyogram and karyotype is that you can use it to detect a number of chromosomal disorder. You can detect a number of chromosomal disorder. They're also pretty expensive to do. Okay. Now this is pretty small, so I will use this bigger one here. What do you notice something interesting about this karyotype or karyogram? Yes?
Number 17 looks like it has like half or some sort of disfiguration on like the second.
Now this is the reason why I decided not to do that activity. A lot of times in this case, like, students will like match this one with like something else, but in fact, nothing's wrong with this 17. Yes. Exactly. There's like 3 of chromosome 21. You really should have a pair of each chromosomes, right? Except the sex chromosome. So in this case, what you have here, an extra, or you have 3 chromosome number 21. This will be when you have 3 chromosomes rather than you should have 2. What you say is trisomy. This condition, this is called a trisomy of a certain number of chromosome. Okay, trisomy 21. It means you have 3 copies of such chromosome. Okay. So think of trisomy. Tri means 3. Somy, like chromosome. Okay. Trisomy. Tri means 3. Somy, like chromosome. Now, not all trisomy conditions are viable. What it means is that some chromosomes, you have an extra copy of it, that embryo will not be carried to term. Something will be wrong and have a miscarriage. Some will work. Okay, so in this case, trisomy 21 is like a viable condition, but this condition will certainly have some problems. Now, trisomy 21, anyone happen to know, without looking things up, what that condition is called? Yes? Down syndrome. That's correct. So, trisomy 21. So that is a genetic condition called Down syndrome. Okay. So the embryo, the baby, will typically carry to term. Okay. It's not, but there will be certain symptoms and conditions. Okay. Down syndrome is actually quite common. Okay. We'll talk a little bit more a little bit later on how that works and risk factors. Now, trisomy 21, that's Down syndrome. Down syndrome. Make sure you know this one. Make sure you know this one. If I could test you on the test, trisomy 21 is, what's the condition called? Oh, it's Down syndrome. Okay. I could totally show you a karyotype of someone or something, and someone, and then I'll ask you what's peculiar about it. It might be chromosome number 21. Then in this case, you are expected to know it's Down syndrome, but it could be other conditions, but I won't expect you to know the name. Name-wise, I do expect you to know 21 is Down syndrome. Okay? Trisomy 1, 2, and 3.
So is Down syndrome only particular to the chromosome 21, or can it be like
having extra, like that trisomy 21, that's Down syndrome.
Okay.
Yeah. Yes.
So what if, is it possible for there to be 3 chromosomes? Let's just say it wasn't on 21 and it was like, I don't know, number 5, 3, like, would that still be Down syndrome, or would that?
No, it will be something else, or it might not, that embryo might not even survive.
Oh, okay.
Yeah.
But if
So
it's on 21, then we.
A trisomy of 21 is Down syndrome. Okay. Yes.
When you refer to test, you mean like our next week test?
Yes. Okay. Yes.
So does the person with Down syndrome carry the trisomy 21 in all of their cells?
Yes. Interesting question. You know what? That's what the textbooks say. A couple of years ago, when one of my child was born, at first the doctor was like, does he have Down syndrome? And then they did a cell test. It's like, well, it doesn't really look like it. And it's like, apparently there's something called mosaic Down syndrome, which means some of the cells will have 21 chromosomes, some of them won't. I never heard of that until that doctor was talking about it, about my son, which turns out not to be the case. But anyways, it was like, oh, I didn't know about that. Questions? Anyways, coming back. How about this karyogram? Yes. Good. There's 3 copies of chromosome 18. Okay. 3 copies of chromosome 18. So in this case here, trisomy of chromosome 18. Now, trisomy of chromosome 18. So let's look up what that is. I don't know. Edwards syndrome. Good. Edwards syndrome. Okay. Do I expect you to know the name that it is Edwards syndrome? No. If you want to know it, that's up to you. Are you guys good? How about this one? Yes. Ooh, there's 3 sex chromosomes. Which 3? 2X and 1Y, okay? 2X and 1Y chromosome. So, a trick question. What would be the sex of the individual?
Female.
Now, interesting. Intersex is actually a very broad term covering a lot of causes. There could be a chromosomal situation. It could be that person's chromosomally like either XX or XY, but somewhere along the line during that 9 months in development in utero, something happened which caused what they call an, I think it's an old-fashioned term, ambiguous genitalia. And then in this case, yeah. In the past, people or doctors will like strongly suggest like surgical intervention in that situation. Nowadays, not so much. By coming back, male, female. If you see a presence of Y chromosome, it's pretty much male. Okay? Just the fact that there's a Y chromosome there, it is a male. Okay? It is. That person is a male. Okay? However, you do have an extra X chromosome. Okay? There is an extra X chromosome. Okay? So, what is this condition? Okay? What is this condition? Extra X chromosome.
Is a Y chromosome dominant?
No, it's not really quite called it that way. Let me just finish one thing after another, okay? So X chromosome is what you call the Klinefelter syndrome, okay? So if you can see here, there are some of these risk factor of men with Klinefelter syndrome. And let's go down here a little bit. So testing other doesn't see.
Maybe the causes, right?
Huh?
Maybe the causes, right?
Just an extra chromosome. Just an extra X chromosome. That's it. Okay. Questions? You look like you have a question.
So when the cell is copying the chromosomes, that means it accidentally copied 2 X chromosomes?
We're gonna get there. We're gonna get there a little later on. That's what non-disjunction causes all these possible things. Okay? Now, earlier, was it you who asked a question? Is the Y chromosome dominant? It's not really called that way, but during the earlier stage of embryo development, the X chromosome plays the most important role. But at a certain stage, there's a gene, SRY gene, on the X chromosome. At that point, it kicks in, it gets activated, and basically the activation of that XRY gene causes the sexual differentiation in utero. Okay, so if that gene works, then the embryo will develop into the typical kind of boy the genitalia will be developed into like the boy type of genitalia. If that gene is not activated or that gene is not present, then in this case, it will go with the female genitalia development. Okay? Questions so far? So this is a situation where like that person could genetically be X and Y chromosome. But for some reason, if that SRY gene on the Y chromosome didn't get activated for who knows what reason, then that person will have a lot of the female genitalia development when they're born. Okay?
The SRY gene said is found on the X chromosome.
Y chromosome.
Why?
Y chromosome. Yeah. Good. All right. So Klinefelter syndrome, and the other person. Wow. What is? Yes.
There's only one X chromosome.
Okay, only one X chromosome. So trick question. Male, female? After what I just said.
Female.
Female. There's no Y chromosome, so that person will be female. Okay?
Is it possible?
Yeah, female should have two X chromosomes. Okay? So in this case, so this one will be now. If you have only one copy of the chromosomes when there should be two copy, what's that term called? Take a guess. If you have three copy of something when there should be two, you call it trisomy. And you have one copy, what do you call that? Monosomy. Thank you. Okay. So in this case, this one, it's, okay, first, that person is female, and it's what you call Turner's syndrome. Okay? Now, because of time, I'm just not gonna look it up here. Yes.
Is it possible to have a triple gene?
Yes, there are. Now, keep in mind, not all trisomy or monosomy that don't pack up yet. We're still not done. Not all of them, the embryo is survivable. Okay, we're just showing the ones that can happen. There's a whole bucketload more. We don't expect you to know. We just expect you to know trisomy 21 is Down syndrome. Now we're going to talk about the cause, so don't pack up yet. The cause of this is what you call non-disjunction. Non-disjunction is when during meiosis stage, usually it's during the anaphase 1 or anaphase 2. Okay? So when either the homologous chromosomes split to either both opposite sides, but they didn't, then in this case, you have an extra chromosome. Okay? Or missing chromosomes. Okay? Or if it is an anaphase 2 and the sister chromatids are supposed to split, but they didn't, then in this case again, 1 out of 4 gametes will have extra chromosome, 1 out of 4 will have 1 less chromosome. Okay? But if it happens on anaphase 1, all 4 gametes will be affected, either extra chromosome or not chromosome. Now, one of the high risk factor why this is the case, I cannot speak on every single issues, genetic condition. One I can speak to risk factor for trisomy 21, which is the Down syndrome. One of it is due to the age of the mom's first child. Simply because when a baby girl is born, all the eggs that she will ever have in terms of her entire life are already in her ovaries. They are just stuck, if I remember correctly, in meiosis 1. at the puberty, a few eggs, 1 or 2 a month, will complete that development and get released. So as the mom's age goes on, those eggs will be older too, and so in this case, the risk factor, especially after when maternal's age after for the first kid after 30 years old, that risk factor jumps up quite a bit. Okay, so there's a whole lot of ideas like, oh, maybe freezing your eggs in your 20s, aside from the whole fertility situation, is also part of it. Is like preventing, lowering the risk of Down syndrome. Okay, are we good? Now, detecting non-disjunction. You guys can read this part. Both of them require in utero. Both of them require in utero checking using ultrasound. Amniocentesis is basically you use a syringe, you extract the amniotic fluid that is surrounding the baby. Some of the embryonic fluid will have the baby's DNA. And so in this case, you can check doing a karyogram or karyotype and see whether that child have a certain problem or not. Typically, it is done by doctor's recommendation before on one of the earlier structural ultrasound testing. Okay. Another one, chorionic villus sampling. This one it is safer. You have less chance of miscarriage. There is always a chance of miscarriage because of the condition of the procedure. Less chance of miscarriage, but accuracy, I believe, is less. I don't know why, but it's less. For a much higher accuracy for the test, chorionic villus sampling is done. Now, you stop an ultrasound, but instead of sticking a needle to collect the amniotic fluid, you actually have a catheter to scrape off a little bit of the tissue that is around the placenta. That is a lot more accurate, but the risk of miscarriage is also significantly higher due to it's way more intrusive. Okay, it's way more intrusive. So those are the ways to detect non-disjunction abnormality, okay, for an unborn baby. Okay. Any questions? Okay. So